Hello everyone, welcome back to my YouTube channel. If you haven't subscribed, subscribe. Today I'm going to discuss about the classifications of mental disorders, which include mood disorders. These are two. We have depression and mania disorder. There is anxiety disorders, which include the panic disorders, stress disorders, or sociophobic disorders. Another classification is childhood disorders. Childhood disorders include the attention deficit or hyperactivity in kids, Asperger's disorders. There is also eating disorder. Eating disorders include the anorexia nervosa ama bulimia nervosa. There is another classification which are personality disorders. These include the paranoid, antisocial or obsessive compulsive disorders. Another classification is schizophrenia and other disorders. Another classification is substance abuse, which include the alcohol dependent disorders. Now I'm going to talk about one by one. Let's start with mood disorders. And in the mood disorders, I'm going to start with depression. Let me define depression. What is depression? Depression is a disorder associated with lowering of personal mood. You are just feeling sad, you lack interest, you feel you don't belong. Actually you feel down. Now there are types of depression. There are two. One type is clinical depression, and we have persistent depression. Depression, it is a major problem in our society. 3.8% people are suffering from depression. Depression, 5% of this population, they are adult. 5.7, they are older adult. And 700,000 people are dying secondary to suicide, which is one of the complications of the depression. I'm going to discuss about symptoms of depression. Symptoms of depression include the depressive moods. The depressive moods are feeling irritable, you feel empty, you feel that there is loss of interest in something, there is poor concentration, there is feeling of excessive guilt, you feel you are guilty all the time. There is also disruption in sleep. You find that today you have different sleeping pattern. There is also a feeling of low self-worth, that is worthlessness. You feel you don't belong anywhere. There is also a feeling of interest in activities. You don't want to do anything. You feel tired. You feel even you don't have energy. The energy is low. You feel there is also loss of appetite. You don't want to eat today. All today you overeat. And this may lead even to increase all of body weight. There is also a feeling of excessive anger. You are angry with everybody. You are angry with anything. Now how those feelings are the depressive moods. They are expressed. These depression moods, they can be expressed in bodily form, in bodily changes. These bodily changes increase. You can express the above moods by crying. You feel pain. You feel fatigue. You feel weakness. You don't have energy. That your body will show these depressive moods. Also, there is difficulty in concentration. There is difficulty in doing things. Difficulty in functioning. That's what I mean. In functioning of your day-to-day activities. Like, you don't want to go to school. Like, in education. In social gathering, you don't want to go. You feel you don't even want to be associated with your family. You don't even want to go to work. This is going to affect your occupation. There are other feelings. Other feelings include the loss of desire. You don't want anything. You feel agitated. You feel restlessness. Even you get to have suicidal thoughts, or you commit suicide. That is attempting suicide. Now, these signs and symptoms, they can even be grouped into, like in female, there are different in male, they are different in children, they are different even in adolescents. Let me tackle the symptoms in female. You know, a woman is somebody who can express her feelings very well by crying. Female can cry. They are irritable. They are have mood swings. Mood swing, today they are down, tomorrow you find that they are jovial. Those are the mood swings. Fatigue. They have aggressive, not aggressive thoughts. They have negative thoughts. They can also be aggressive in one way or another. In men, they have excessive drinking of alcohol. All the time they are high. All the time they are high with alcohol. That is a sign of depression in men. Also, they have displaying hunger. Displaying hunger, like all the time they are angry with something. Even something that is not relevant, they are angry with it. They are also able not to socialize with the family. They avoid the family, they avoid friends, also they avoid their close friends. They are difficult in keeping up with work. A man will not be able to go to work. They are abusive. They want to control. They want to be in control in a relation. Like a man wants to dictate the wife what they want to do. This one is a sign of depression in men. Now, even in adolescents and the young adults, there is adolescents, young adults, mostly those who are going to school-going adolescents. School-going adolescents, now they can start having insomnia, lack of sleep. They have difficult concentrating in studies. This person is not able to concentrate in a study. They have too much sleep. If they don't have sleep, others they start sleeping a lot. They have increased appetite or decreased appetite. You find that a person is eating too much, or they are not eating at all. They also avoid social places, the activities that they like. If an adolescent like going to play football, they start losing that urge of going to play with his friends. They are feeling guilty, they feel restless, they feel as if they are withdrawn ideally, they are not themselves. And that person has depression. Now in children, small children cannot express their feeling verbally. They cannot tell you, Mama, I'm feeling this, or Dad, I'm feeling this. But you are going to note some of the things that this child is not well. This child, there is something disturbing this child in his brain or her brain. Like crying, their cleanliness, that they want to clean on their parents. When you want to go to work, a baby comes and hugs you. He doesn't want you to go. They just want you to stay with them. They have low energy. A playful child is not playing. They are defiant. They have even local outbursts. Those are some of the signs and symptoms that I've discussed about depression. And now I'm going to discuss about the causes of depression. There is no identified cause of depression, but there are risk factors which can lead to depression. One of the causes is abuse, physical abuse, sexual abuse, emotional abuse. These ones in later they can cause depression. There is also age. Depression is much more in older people than in young. There is also some medication, some of the medication that we use, like some of the antihypertensives like beta blockers or statins, which are used in the management of cholesterol, can also, and other drugs can also lead to depression. There is also conflicts and disputes in our family, in our society. These ones can predispose somebody to depression. There is also death, the grief period and sadness. This one can prolong, it can go, they can get bad, and this person can start being depressed. Also, there is genes, they run with family history of depression, they run with family. There is also another cause, which is the social serious illnesses like cancer Also, there is substance misuse, like the use of alcohol that can lead you to all other drugs. They can lead you to depression. Also, gender also is an associated factor, which we have seen that depression is much more in female than in men. All those causes that I've mentioned and others, which are example of this, the above, they can lead somebody to depression. Now, how do we manage depression? Management of depression. Depression, if detected early, it can be cured, it can be ceased. If a person gets a good care, that person can be well. And this management, they might even need something like lifestyle, they need psychological management. There is also learning about the condition. First of all, you learn about the condition, know about this condition that you are having. Then lifestyle, your lifestyle, you have to change it. If you saw that you don't like, we've seen one of the symptoms is withdrawing from activities that you have used to be going, like in adolescence. You find that you usually like to go to play football, but all of a sudden you start withdrawing from friends. You don't want to go anywhere, don't want to go and play with your friends. That is one of the lifestyle that you can adjust. If you see that you have started to withdraw, you can try and start socializing with other people. Another lifestyle is disturbing sleep. You start changing your sleeping pattern. There, a person can start even to design a pattern in a way that that person will be having a sleep in such a way that is going to manage the depression type. There is also psychological therapies. The psychological therapies is where we have the talking therapy. You talk with friends, you talk with a counselor, you explain your problems to anybody else. Then alternative, there is also medication. Those medications are classified now. That is where you need to go and see a psychiatrist to give you antidepressants and to tell you how you are going to cope with the antidepressants. Thank you very much for your time. I hope that you've got something. Continue subscribing to my YouTube channel. Thank you. Bye.